Chemotherapy medicines are powerful and can sometimes cause side effects. Your side effects will depend on what kind of chemotherapy medicine you have, as well as your biology. In this video, we will go over the many side effects and what you can do to reduce any discomfort. One of the most common side effects people experience is fatigue, or extreme tiredness. Many medical studies show that exercise is the best way to prevent and treat fatigue. It is recommended that you get at least 30 minutes of exercise every day. You should also eat 3 to 5 servings of fruits and vegetables and choose whole grains and lean meats. Drink at least 64 ounces of fluids a day. Try to limit drinks that contain caffeine. And get at least 7 to 8 hours of sleep each night. You can also take small naps throughout the day if you need to. Plan your activities for when you have the most energy. Be sure to ask for help when you need it. Nausea is another common side effect. Nausea is when you feel like you want to throw up. There are 2 cards in your chemo packet that can help you manage nausea. The card titled How to Manage Nausea at Home has great tips on things you can do to minimize nausea. And the one titled My Nausea Medications has information on how to take your anti-nausea medicines. Nausea and vomiting can cause dehydration, so make sure you continue eating and drinking. Your anti-nausea medicine can help. Tell your doctor if you still have nausea after taking your anti-nausea medicine as ordered, or if you can't keep food or fluids down for more than 12 hours. Some chemotherapy may cause hair loss. This may include the hair on your body as well as the hair on your head. Hair loss usually happens over weeks or months instead of all at once. If your hair is going to fall out, it usually starts about 2 to 4 weeks after the start of treatment. It is a good idea to wear a hat or scarf to protect your scalp from the sun and cold. Talk with your nurse about wigs and other options in your area. If your eyelashes fall out, wear glasses to protect your eyes from dust. Your hair should start to regrow within 2 to 3 months after ending chemotherapy. Your new hair may have a different color or texture. In rare cases, it may not grow back. See the card titled Managing Hair Loss, Alopecia, in your chemo packet for more information. During chemotherapy, you may also notice changes to your fingernails and toenails. They may break, split, or peel, or form lines or ridges. Keep your nails trimmed short and your hands and nails clean. Apply moisturizing cream to your hands, feet, nails, and cuticles regularly. The card in your chemo packet titled Chemotherapy Nail Care has more information. Good skincare helps prevent sores or scratches that can easily become infected. Some chemotherapies make your skin more sensitive to the sun. It is recommended that you wear sunscreen with an SPF of 30 or higher and a broad-brimmed hat when spending time in the sun. Lotions should be alcohol-free and fragrance-free. Drink plenty of fluids to keep your skin hydrated. Hand and foot syndrome is a side effect of some cancer drugs. This is when redness, blisters, swelling, sensitivity or pain, extreme dryness, calluses or cracks form on the palms of your hands and soles of your feet. These side effects can get worse the longer you are on chemo, but should get better after treatment is finished. Talk with your nurse or oncologist if you experience any of these symptoms so you can find ways to make you more comfortable. If this is a possible side effect of your chemo, you will find additional information in your chemo packet. Some chemotherapies can damage the nerves in your hands and feet. This may cause changes in sensation such as numbness, tingling, discomfort, pain, a burning or warm feeling, less ability to feel hot or cold, or cramps in your feet. This is called neuropathy, and it can affect your ability to walk or to use your fingers to do things like write. Sometimes these symptoms go away shortly after treatment is done, but sometimes they last much longer. Sometimes it does not go away. Tell your doctor if you have these symptoms. They may need to delay your treatment, use smaller doses, or stop using the drug that is causing the problem. Good dental care is very important. Be sure your dentist knows that you have cancer and tell them about your treatment plan. Routine mouth care can help prevent infections. Brush your teeth after meals and before you go to bed. Use only alcohol-free mouthwash. Your doctor may tell you to use salt and baking soda mouth rinses at least 3 times a day. See the mouth care card in your chemo packet for a recipe. Call your doctor if you have painful sores or white patches in your mouth. Some medicines may cause diarrhea and some may cause constipation. Information on how to manage these symptoms is included in your chemo packet. Another common symptom experienced by cancer patients is memory problems. This is often called chemo brain or chemo fog. You may find that you have problems with many things at once, paying attention and concentrating. These issues will usually get better over time. To help manage these symptoms, follow these recommendations. To stay organized, make lists. Put your keys or other valuables in the same place every time, and set reminders on your phone. Exercising will help you manage stress and anxiety, which can make memory problems worse. Do things that require concentration at the time of day when your energy levels are at the highest. Limit alcohol. It can make it harder to keep a clear head and can interfere with sleep. Follow medication instructions from your care team and avoid any medications that can make it worse. Ask your team for a list. And ask for help managing depression, anxiety, sleep problems, fatigue, or pain. Dexamethasone is a steroid medicine that may be prescribed as part of your treatment regimen. It treats inflammation and prevents nausea. It can increase your desire to eat, prevent reactions to other medications, and treat certain types of cancer. Dexamethasone can keep you awake, so it's best to take it early in the morning with food. Take each dose exactly as prescribed by your doctor. It may also raise blood sugar levels in some people or cause agitation. If you experience these symptoms, talk with your doctor. Eating well is important while you're being treated for cancer. Protein is especially important in helping your body heal. Your body is working very hard and needs a lot of calories for energy. Eating the right kinds of foods before, during, and after treatment can help you better tolerate your treatment and give you more strength for recovery and healing. Drink at least 64 ounces of fluids a day. Limit the number of drinks that contain caffeine. See the handouts Nutrition During Cancer Treatment and Power Packing in your chemo packet for important tips on eating healthy. Let your doctor know if you would like to talk to a dietitian to learn more. Be sure to talk with your oncologist before taking any vitamins, herbs, probiotics, or other supplements you are taking to ensure they won't react with your cancer medications. After you receive chemotherapy, most of the drug waste comes out in your body fluids, such as pee, poop, tears, sweat, vomit, semen, and vaginal fluid. Other people and pets could be exposed to the drug if they come into contact with your body fluid during the first 48 hours after treatment. See the handout, Hazardous Medication Precautions, in your chemo packet to learn how to keep you and your loved ones safe. Because we do not know if the small amount of chemo in vaginal fluid or semen after cancer treatment is dangerous, protect your partner by using a barrier during vaginal, oral, or anal sex to protect your partner. Sexuality is an important part of your health and wellness. See the booklet Sexual Health in your chemo packet for additional information about how to manage possible symptoms. Please reach out to your doctor or nurse with questions. Chemotherapy may affect your fertility or ability to have children. This is because it can damage both the sperm and eggs needed for reproduction. It may also cause birth defects. Because of this, you should use birth control so you do not conceive a child while receiving treatment for cancer. If you are concerned about your fertility health and how chemotherapy may affect your ability to have children, ask your doctor for a referral to a fertility specialist. There may be some things you can do before you begin treatment to preserve fertility later. After hearing this information, you may experience many challenging emotions. You may be feeling scared, overwhelmed, or worried. Don't be afraid to share your feelings with your care team. They understand that cancer treatment is scary and hard, not just for you, but for everyone you love. They can connect you with specialists who can help you process your emotions and connect with resources and support groups in your community. To keep focused on your health and to help keep things simple, remember these 5 things. Keep an updated medication list with everything you take. Keep your chemotherapy wallet card with you at all times. Tell your healthcare team about any new symptoms you are having. Call your doctor right away if you have a temperature of 100.5 degrees Fahrenheit or higher, or other signs of an infection, such as chills, a cough with yellow or green mucus, a sore throat, or pain when you pee. Call 911 if you experience an emergency, such as chest pain or difficulty breathing. The Intermountain Health Cancer Team is here to support you, and we wish you the very best on your journey.